Hi everyone, I'm Sakamoto. There was great response to the last video about regenerative medicine against meniscus tear. So today, I'd like to introduce an actual case at our clinic. First, let's see the structure of a knee joint. Here's a front view model of right knee. There's femur on the upper side, and tibia on the lower side. The thin bone on the right is fibula. This is patella, also called a kneecap. Looking into the inside, there's a smooth one called cartilage, and this blue one is meniscus. Meniscus is composed of two C-shaped parts as shown in the close-up picture. It plays the role of a cushion in the knee joint. When the meniscus is gone, the cartilage beside the meniscus wears away. It results in osteoarthritis, which causes deformation of the knee. In our case, the patient was a man in his 60s. He was a marathon runner, but had got knee pain for a year. The first opinion was slight damage to cartilage, but an MRI scan showed meniscus tear. He was recommended to get surgery, but he wanted to avoid it by all means. That was when he found us and regenerative medicine on the internet. As I told in the last video about meniscus tear, arthroscopy is the major treatment method. It makes a few holes on the knee, then pass small scissors through them to monitor with a camera. There are two surgical methods. One is to suture injured part with threads. Another one is to cut jugged part round and smooth. This one is used in most cases because suturation has a success rate of only 70 to 90%. Also, about 30% of the patients experience re-tear after 4 years due to the low vascularity of meniscus. Suturation even requires several months for hospitalization and rehab. In the case of re-tear, it's necessary to take arthroscopy again and suture or remove the part. Resection also has a disadvantage that about 30% of people have knee osteoarthritis after about 10 years. It is reported that the percentage rises up to 70% in the case of athletes. To summarize, arthroscopy for meniscus tear has a risk of future re-tear and of knee osteoarthritis after a certain period. Meanwhile, regenerative medicine overcomes these disadvantages. Even under meniscus tear, it's possible to regenerate meniscus by injecting stem cell. There is no need to remove the injured part as like in arthroscopy. The most ideal treatment is to preserve the meniscus as a cushion to prevent future osteoarthritis. Let's see the X-ray photo of the patient. You can see that the cartilage is a bit worn out. Next, here's his MRI image. This black triangle shows meniscus of inner knee joint. Do you see the white line in the middle of the part? This is horizontal tear of meniscus. After a month of the treatment with regenerative medicine, he gradually got relieved from pain. He could jog slowly after 2 months and jog as usual after 3 months. The conventional arthroscopy required to cut off meniscus. However, it always resulted in the deformation of cartilage. Knee osteoarthritis caused more pain and led to the introduction of an artificial joint. Meanwhile, stem cell therapy is much effective against knee osteoarthritis as well as meniscus tear. In this case, the horizontal tear of meniscus was recovered at first. Next, the slightly worn-out cartilage was regenerated. These two procedures eliminated his pain significantly. Now, 6 months have passed, and he's able to jog without pain. However, it is believed that he had been covering the injured leg due to pain that lasted for several years. Therefore, the injured leg had weakened muscles and poor joint movement. At our clinic, we're teaching muscle training around the knee and muscle stretching. As the patient came a long way to our clinic, we also offer after-treatment services online to check whether the rehab has undergone appropriately and evaluate its efficacy. In summary, the conventional treatment for meniscus tear required cutting off meniscus, which made future knee osteoarthritis unavoidable. Regenerative medicine is able to remain and regenerate meniscus, avoiding wearing out of cartilage and future osteoarthritis. We've treated so many patients suffering from other arthropathies as well as meniscus tear, most of whom have gotten back to their normal lives, such as playing sports. Today, I introduced an actual case of regenerative medicine against meniscus tear. Thanks a lot for your attention!